Hi, welcome to Healthcare Hoax. Remember, if you go to Healthcare Hoax Videos, you'll come right to our healthcarehoaxvideos.com. You'll come right to our YouTube channel. When you get to our YouTube channel, remember to like our videos. Please share our videos with family and friends. You can also subscribe when you go to healthcarehoaxvideos.com. And when you subscribe, you'll find out when the latest new video has been posted. I'm Janet Cimorelli, licensed nutrition counselor. I'm here with Dr. Herb Slavin, functional medicine practitioner. Hi, Dr. Slavin.
Hi, Janet. And I want to sort of summarize healthcare, how it's practiced in this country. And if you think about it, it's geared towards looking for ways to make money on patients.
Whoa.
In other words, it's looking for patients who are sick so they can make money, as opposed to looking for ways to keep patients from getting sick. I'll give you a few examples. They do stress tests on patients to see if you're a candidate for bypass surgery. But they don't do a test, for example, like a calcium score that might indicate that you're at risk down the road for problems that they can intervene earlier on and prevent the need for bypass. Another major area is breast cancer. They do mammograms looking for women with breast cancer because I think every breast cancer is worth about $100,000.
Wow.
Between chemo, radiation, surgery.
That's a lot of motivation to be looking for cancer.
And women are under the false expectation that, oh, the mammogram is normal, everything is fine.
So they've been hoaxed.
Okay. So it's true, mammograms look for cancers, but wouldn't it be nice if there was a way to identify women at greater risk of developing cancer 5-10 years down the road, and you can intervene and lower that risk? See, that's the whole area that's not being addressed.
I think women are going to have a hard time believing that there's a way to identify their risk 10 years out. How do you do that?
Well, let me talk about something that all women are familiar with, especially in their premenopausal years. A lot of women complain of breast tenderness before their period, and the doctor says, that's normal. But it's not normal. It's very common, but it's not normal. What's causing the breast tenderness is a hormonal imbalance, too much estrogen, not enough progesterone. And that hormonal imbalance, besides being a risk factor for the development of breast cancer, is also a factor in the development of uterine fibroids. And I'm sure there are a lot of women who know that this has happened to them. Totally ignored, never addressed. The way to address it is just to take extra progesterone to balance the high levels of estrogen that you have.
And I have to say, they have to be careful that they're getting actual bioidentical progesterone, because the medical community does have a synthetic version of progesterone called progestin, and that has a very long list of negative side effects.
Yes, and although they shouldn't use them interchangeably, they do. Progestin is not progesterone. Progesterone is the hormone that the female body makes, and progestin is an artificial hormone. And here's what some of the problems that occur. You cannot measure progestins in the body. When we do a blood test to measure estrogen or estradiol or progesterone, that's what we measure. If someone is taking artificial estrogens like Premarin or progestin, they won't show up on these blood tests. So women taking birth control pills or artificial hormones, you have no idea the effect it's having on those women because you don't know if they're imbalanced or not. So that's the first thing. Why would you want to put anything unnatural in your body? And that's part of the reason why we prefer to avoid drugs, because all drugs are unnatural. No such thing as a natural drug, because then they couldn't patent it.
Okay, so measuring estradiol, estriol, and estrone. those three different versions of estrogen, do you get any meaningful information about breast cancer risk with measuring those forms of estrogen?
Well, I think the main measurement is the ratio between the estradiol, which is the predominant estrogen, and progesterone.
Okay.
You want to make sure there's a good balance there. And the effects of an imbalance on a woman, you're going to get overstimulation of the breast tissue, and that overstimulation over time is a risk factor for breast cancer. Now, the only way to visualize that or to see it is with a thermography, a breast thermography. It's a very simple test. You're using an infrared camera that takes pictures of the temperature of the breast. And if you have unequal temperatures, or one breast looks warmer than the other, these are not normal conditions, so there's an issue there. And we combine that with the lab work, and once you balance the hormones, then the thermography goes back to normal.
So you see a change in the thermographic picture when hormones are balanced.
Absolutely.
Amazing. So how many women out there, year after year after year, go faithfully for their mammograms and unfortunately don't necessarily have the information with regard to ratios of estrogen to progesterone, don't have the kind of nutrient support that will reduce risk? What are some of the suggestions that you might make, Dr. Slavin, with regard to nutrition support?
Well, iodine is a good nutrient to make sure you're not deficient, and iodine helps with estrogen metabolism. And then there's a nutrient available everywhere, diindolylmethane, DIM, that also helps metabolize estrogen in a healthy direction. So those can be very important. Think about this. You go for your yearly mammogram, and after a couple of years, the doctor says, now I found the cancer, and now we can put you in for treatment. He didn't do anything to say, you're at risk of developing breast cancer, let's make these changes so you don't develop breast cancer. See, mammograms, besides being a poor tool from the standpoint just the quality of the images, it's also a risk factor for breast cancer because of the radiation and compression that you get every year.
I think that a lot of women might be very surprised when those two aspects are kind of brought into their conscious awareness, that there is compression. And I refer to it as traumatic compression because it can be very painful with that compression during a mammogram. And then when you are exposing that soft tissue to radiation, that combination can be certainly very dangerous.
The doctors are not making women aware that they can be proactive for themselves in reducing the risk of developing breast cancer. They don't do that. They just say, come every year for your mammogram, and when we find breast cancer, we'll treat it. So here's a story. I have a patient who's in her late 80s, and her daughter, who was in her early 60s, developed breast cancer and went for mainstream treatments. And after about 18 months, she was dead. And I'm sure she died more from the treatment than from the cancer. And that's a common event with a lot of women who go through radiation.
I know you know the client that I'm speaking of when I say a woman in her late 40s, early 50s developed a lump, and her family, being very much in the medical community, was supportive of her going through biopsy, radiation therapy, chemotherapy, possibly a lumpectomy, a lot of different mainstream medical treatments. And for whatever reason, the support I gave her with the information about nutritionally minimizing the possibility that that lump could be seriously injurious to her health, she went without mainstream medical attention. And what she did was dramatically change her diet, dramatically change her lifestyle, and enhanced detoxification. So she's doing vegetable juicing, she's doing nutrition therapy with specific supplements. So a lot of very effective and very focused therapies from the natural realm. And one of the things that she said to me very recently, the last time I saw her, was that her lump was almost indistinguishable. She was barely able to feel the lump in her breast. And this is probably beyond her 10-year mark after the first discovery of this lump. And she remarked that a number of her associates who had been diagnosed slightly after her diagnosis, and their mainstream approaches of lumpectomy, mastectomy, radiation, chemotherapy, those friends and associates did not make it. They succumbed to the cancer. And here she is, more than 10 years out after her diagnosis, feeling well and doing very well, been working entirely through this process, and it was supporting her immune system, balancing her hormones, and paying attention to an enhanced lifestyle. So we know that natural approaches work.
Not just that, Janet, it's been reported that as much as 1/3 of breast cancers go into spontaneous remission.
That's interesting. Wow. I didn't know that.
And several years ago, I think it's going on 5 years now, there was a study reported in the New England Journal of Medicine. And the study was designed to answer the question, after doing screening mammograms for over 30 years, are we saving lives? And the summary of the report was that the same number of women in the screening group getting their yearly mammograms were dying from breast cancer as the women not getting mammograms on a routine basis. In other words, doing that yearly mammogram doesn't change the outcome. But it makes money. See, the point they made was, but it makes money through radiation, chemo, surgery. It's a moneymaker, but it's not a lifesaver. So when we talk about these topics, it'll motivate you to do your own research. Go on the computer, put in those search terms, breast cancer statistics. When they talk about the benefits of chemotherapy, they say it's effective in only 2 to 3% of the cases.
Wow.
Not a very effective treatment modality. From a patient's point of view, from the medical establishment's point of view, very effective. They make a lot of money with it, but it's not the best choice for you. So these are the kind of hoaxes we're talking about. You're not being told that there are a lot of things you can do to take better care of your health and get better outcomes than what mainstream medicine is offering.
So don't be hoaxed. Come here to healthcarehoaxvideos.com, subscribe at our YouTube channel, and share the videos with family and friends. I'm Janet Cimorelli. I've been talking with Dr. Herb Slavin about maintaining your good health, and this is where you'll get the information about true health, not necessarily disease care. Don't be hoaxed. Tune in to healthcarehoaxvideos.com.